So transthoracic echo is considered a low-risk procedure for spreading infection, but it could. You, the machine, the patient could spread infection around. Your institution will have protocols and policies to cover this, but it's a really good idea to get into good habits right away. In my institution, we rely on hand washing before and after we do the echo, but there are other places that will be using things like microbial sprays or gels. Some departments will use disposable gloves routinely for every study. There will be some degree of assessment of the risk of infection. For example, if a patient has a wound on their chest, which we do see obviously in cardiac work, if the patient's had surgery, the risk is increased, and we're talking about a medium risk then. We also need to scan in environments such as intensive care, or where patients may be compromised themselves or may have an infection. Those situations you'd be thinking about wearing aprons and masks and whatever your department recommends you use. Just make sure you know what you should be doing and you know how to dispose of the equipment afterwards. We need to think about how we're going to keep our equipment clean. Obviously, things that actually touch the patient are most important to think about. So that will be the probe and the ECG cable. We need to be really careful with probes. They're very delicate, and you probably need to consult with your manufacturer to see what they recommend, so that you use an appropriate tissue to wipe off the gel at the end of the study, and then you clean it. There are special sprays to do this that are very gentle but still can make the probe safe. So it's good practice to get used to checking your probe for breaches. So we're talking about checking this end bit here that touches the patient. We're looking for cracks or scuffs. That's because infection can get caught up in those. And also, if you breach the probe electrically, obviously that's dangerous. I usually use wipes to clean the ECG leads after every patient. The machine itself is more robust than the probe, and again you can use something like this, a wipe or a spray, to make sure you clean it. Maybe you do that once a day, but you should be doing the things that touch the patient after every single patient. Infection control has to be the responsibility of the echocardiographer doing the study. So if you're not sure if your machine is being cleaned, you need to clean it yourself before you use it on a patient.